Hi, my name is Marilyn Morrison. I'm one of the program advisors and professors here in continuing education in the Faculty of Health Science and Wellness. Today I'm going to talk to you about some clinical placement components. We're going to look at the course outline in more detail. Okay, so in the course outline, after you get through your learning outcomes, there's an evaluation activity chart. This chart tells you what you're responsible to submit and which timelines you're responsible to submit those in. Please make sure you email all your documents to Nita Parmar in the office and to the program advisor overseeing your course. Clinical self-reflection daily logs. These need to be submitted daily. The purpose is for you to reflect on what you've seen and learned and done, and to be able to share that knowledge with the program advisor. It also acts as a way you can look back and see what did I do in the past. So for instance, you may be able to take your daily logs with you to show at a job interview. Here's an example of a daily log that I will have sent out to you as well. This daily log has the name of the course on top. For instance, this one says NEF 515. You'll put your name and the date of the shift that you've done. Then you'll list the patient's by diagnosis, not with a name. For instance, here it says male and their age, and then what was happening. They were in the hemodialysis inpatient, or it says this was a male, he was 7 years old, he had a tonsillectomy. For women in labor and delivery, here are two situations down here. So what patients did you see in your setting? Now, if you had a lot of patients that you saw, maybe there are 8 or 12 or more, I don't expect you to write them all down, but pick a few salient situations and patients that you help care for or you observe care for, and you can document those. The next part is achievements. That means, what did you do? What did you observe? What did you learn? Here's some examples. I completed a physical assessment on both patients pre-dialysis. Something you did. Another one is, I independently gowned and gloved myself and the surgical team. This is for the OR. Another one, I observed assessments of women in the triage area. If you did something with assistance or under supervision, you could write that with supervision. If you saw something, for instance, I observed an arterial stab by the RT, you could write that down too. The next category is learning opportunities. It's broken down into 3 categories: cognitive, affective, or psychomotor skills. Cognitive is fairly easy. This means about what you know. It's about knowledge. So in nephrology, for instance, you may need to talk about, I forgot about the reasons for a certain drug being added to the solution. So that would be a cognitive learning opportunity, something you can learn about. Another one might be, I forgot the order in which to count the instruments. That's a cognitive, something you need to be able to think about. Psychomotor skill is also fairly easy. A psychomotor skill could be connecting tubing for the dialysis, or cleaning the dialysis machine, or it could be performing physical assessment of the respiratory system. Those are psychomotor skills. Now, learning opportunity again means a gap in your skills. The last category is affective. What that means is how you think and value things. An example is, I was told that I seemed too busy to listen. So what is the value of listening to patients or understanding their story, especially for patients in nephrology, for example, who may have been coming up to 30 years for dialysis? This is like their home unit. So what value do you have? Or maybe someone came into the emergency department and they really look like they've been living on the street for a long, long time, and they didn't have very good self-care. What did you think when you first encountered them? All right, then choose next to go to selected learning opportunity and learning strategy. Of the things you've written under learning opportunities, select one from the above, it says. So you select one, And you'll see I've picked 4 different examples. So here's one. I forgot the order of counting sponges. So that's the learning opportunity. Next is, what is your learning strategy going to be? Meaning, I can't come back to this clinical placement doing the same thing, forgetting what am I going to do to increase my knowledge. So I've written down, I'll review the ORNAC standards, PowerPoint, and I will talk with my preceptor tomorrow about how to ask for assistance during the case. That's just an example. There's another one. I had difficulty with a patient who was from a different culture. He would not make eye contact. He insisted on speaking with the MD, not the nurses. So what is your learning strategy? I will read about da-da-da. Okay, so those are some things to help you to start to understand. So you choose one only and you elaborate. It would be a great idea if you watched a video to write down the name of the video you watched. If you read a book or something, to include the page numbers, for instance, ORNAC standards, and what page numbers did you actually get this information from. Alright, so that's about your daily log. Thank you.